And let's move on. And Dr. Krol, next topic, I want to talk about some common baseball injuries and rehabilitation. And a gentleman from Athletico will be joining us here in a couple of seconds. But are things starting to ramp up in your orthopedic practice?
Steve, they are. I've certainly had projections that for a variety of reasons, the fact that there's very little in the way of organized sports. People are unfortunately unemployed, do not have health insurance, they're not as active, and we're seeing just less sort of load or injury-related phenomenon where the business will be down for a bit. Good thing for individuals, but not good if it's associated with less activity. That being said, we're starting to see pick up as people are comfortable with maintaining social distancing, wearing masks. They're still getting out there and beginning to be active. And quite frankly, in my office this last week, I had a number of young people who are starting to throw and train and do things. So they're getting some signs of overuse and so forth. So, we're going to, the world will be a little bit different for a bit, but people, when they're active, are still going to get injuries and disability. So it's happening, but it's not going to be at the same pace I think that we're all accustomed to.
Let's bring our next guest, Eric Krol. Eric is an occupational hand therapist at Athletico, athletico.com. They do such a wonderful job. And Eric, let's talk right now, if we can, and relate this to the pandemic going on. Kids are obviously trying to throw outside where they can, but without probably proper coaching. What are some of the common injuries to the shoulder and elbow in overhead athletes that people should be aware of?
Yeah, thanks for both having me. So at Athletico, one of the more common injuries that we see with the upper body are due to overuse or repetitive mechanisms to the shoulder girdle or to the elbow. So with kids coming out now and the weather getting nicer, maybe we have to look at what they were doing the past couple weeks or the past couple months prior to this to ensure that their mechanics are where they need to be, and two, have they been training some of their functional core or other areas of the body that could prevent some of these repetitive or overuse injuries to the shoulder and the elbow. So with us, we'll see, athletes or players have impingement syndrome, which will affect the tendons or the muscles of the rotator cuff. And depending on where they come with their recovery process, will determine what sort of skill-specific or functional strengthening exercises that we'll choose to do with them.
What are some of the things that you do for your athletes with upper extremity problems in terms of the non-surgical realm? Yeah,
so for me personally, I like to use a lot of isometric strengthening as well as dynamic stabilization. And I think both of those in combination with one another will get the mechanics where they need to be, as well as looking at the body from a gross perspective and addressing breakdowns or some weaknesses along the kinetic chain, maybe at the core or the hips. So just because we're looking at a shoulder or an elbow problem, I do like to address other areas of the body that will ultimately improve the mechanics and the performance.
Visiting with Eric Krol from Athletico. Eric, tell our listeners, you guys are open, aren't you? Most of the Athletico facilities, if not all of them, if people feel comfortable enough to come in?
Yeah, we're here. We're running normal business hours as usual, and we also have rolled out our telehealth services. If someone is unable to or uncomfortable with coming into the clinic for a customized treatment program, we can do telehealth visits through the computer or through the phone in a safe manner if the person so wishes. And that therapy is equally as customized to the patient's injury and where their goals and recovery process are at.
And Dr. Krol, let me ask you as it relates to physical therapists and specifically here at Athletic. You probably did surgeries on them in January, February before we were kind of shelter in place, and talk about the importance of continuing rehab and what some of your patients have been doing and how they can take advantage of Athletico being open.
Steve, it's important that when we've made a decision to do surgery for something that is either time sensitive or considered urgent, that we also have the ability to manage them after surgery. So what we're hearing from Eric is that Athletico and these offices having availability, but at the same time practicing proper social distancing, patient and staff screening. That allows us to go full circle and provide all the things that they need. In addition to that, we have been using the telemedicine aspect, and Athletico has been great at providing that for our patients where need be. So I would argue that it can be business as usual. We just have to be very thoughtful that we don't overwhelm the system, because it is a bit less efficient, but you can still provide the same quality care. But at the same time, less efficient, Steve, the demands are a bit less anyway. So I think patients are actually having a very good experience, fortunately, at a time when surgery it has to be done.
And final question for Eric Krol, again joining us as our guest from Athletico. Eric, what are some of the things people can do to prevent injury while participating in baseball, softball, or any other overhead sports?
Yeah, thanks for that question. I think my best recommendation would be to address proper mechanics first, and then secondly, look at not only areas that involve the skill, like the shoulder or the elbow, but look at the other areas and how they're training those as well, like the core and the hips and the leg muscles. I think cross-training and giving variety to the workouts will prevent overuse injury, and I think it'll ultimately lead them, keep them on the field for much longer with less risk of overuse.
Good stuff. Eric Krol, Athletico.com. And folks, they are open, so take advantage of their services. They do an awesome job. And Eric, thanks so much for joining us here on Sports Medicine Weekly.
Okay, thank you both.
And Dr. Krol and I have to take a break. And when we come back, it's our Ask the Doctor segment. You're listening to Sports Medicine Weekly only on
670 The Score.